Hi Ashley, it's Dr. Buford. We're just getting started on your right shoulder. You're laying on your side and your arm is up in the air. And we've got this kind of gray cannula, this one coming in. And then we've got a metal cannula here. We're going to put the camera through there in just a minute. This is the biceps tendon running towards the top of the screen here. And as you look down at the biceps anchor, it's not really that detached. We're going to look towards the back of the shoulder and show you. See how the labrum's torn back here? This is one of the places where that ball's slipping over the edge. You can see some of the tearing there. I should mention your shoulder was very unstable under anesthesia. It was completely loose to the front, completely loose to the back, meaning it would dislocate both ways. And you can see there's a lot of space in here, which suggests the laxity in the ligaments, in the capsular ligaments. And you can see some of the tearing there in the labrum. So the rotator cuff looks good. That's the rotator cuff at the top of the screen. And the anatomy in the front of the shoulder looks pretty good. This anterior band of the inferior glenohumeral ligament, not quite as robust as it will be when we're done. Obviously, we can see all the way down to the bottom of the shoulder here because of the looseness. So we're going to go ahead and put the camera in the front, go off on the video for just a minute. Okay, so here you can see we're looking towards the back. Here's a tear in the labrum here. We're going to use our shaver just to trim that down. Now we're going to take an instrument called a rasp to gently roughen up the capsule here. Make any holes, but we do want to roughen it up to create a healing response. Okay, so the next step is to take a spinal needle and to check our angle. We want to put a suture anchor down because there's really not much labor in there anymore. There you can see the type of angle we're trying to get here, down into the bone. So through this little hole, we're going to pass a percutaneous drill guide. Down. And now we're going to go ahead and use a drill, a little flexible wire. And now we'll go ahead and pass the anchor down in just a second. Okay, so here we've got our suture hook here, and we're going to start here because that's where we want to end up, and then we're going to rotate back, maybe go a little bit inferior to do a shift, and then we're going to go into the capsule. Feed that through. And pause. Okay, now we're going to do the same thing one more time. This is what we call a mattress stitch. So again, we're going to start here. You can see the prior stitch. Now we're going to come through here. Posterior capsule is thinner than the anterior capsule, so we get good bites. And then we come through the labrum right here. get this retrieved and show you some more in just a second. Okay, so we're just clipping the sutures from the first. We're going to place a second one, but already you can see how we're closing down the space here in the posterior aspect of the shoulder, which is exactly what we're trying to do. Pause, please. Second mattress stitch in the back. You can see how much tighter that is now. I'm happy with the way that looks. Okay, and now we're going to have a look in the front, decide if we need an anchor. We're going to definitely tighten up that anterior band of the IGL, which you see right there. I'm just not sure if we're going to use an anchor or not yet. Pause, please. Okay, so now we're looking down the front. We placed an anchor down. We're going to end up here, so that's where we start. And now we just rotate back. We're going to go right through this band of the ligament. Come through, like that. And then we're going to bring this underneath the labrum. You can see the labrum's a pretty small structure in your shoulder. And we'll come right through there. We'll go ahead and retrieve the relay. And we'll show you some more in a minute. Pause, please. Okay, we're placing a second anchor in the front to try and balance the repair. We'll take our turn to the right suture hook next. And our goal here is to get right back here, right in front of the infraglenohumeral ligament. Get goodbye to this capsule, like so. And to bring that underneath right there. So we'll go ahead and feed that through and retrieve it. And we'll show you some more in just a minute. Pause, please. Okay, so there's the result of our second anterior suture, and we balanced the repair. There's a lot less space in the joint now, as you can see, and I'm happy with that. We just have to give that a chance to heal. The space you see here is the subscapularis recess, and that's normal. So we're going to finish up here and get you back to the recovery shortly. Good luck to you now. Bye-bye.